All right. Well, good afternoon, everyone, and welcome to another Coffee and Conversations with Legislators. I am here today with a absolute star in the Maryland General Assembly, Delegate Joseline Peña-Melnyk. She is the Vice Chair of the Health and Government Operations Committee. She is involved in just an enormous number of big ticket issues that we're going to get to today. She's a delegate from Prince George's County. And really is seen as a rising star. We were just talking offline about all the calls she's fielding about running for other offices and so forth, but she is committed to her district and committed to being a star in the Maryland House of Delegates. And so I'm ecstatic about what we're going to talk about today. So Delegate Peña-Melnyk, thank you first of all for joining the Maryland State Bar Association for an hour to talk about some issues.
Thank you. I really appreciate you. Thank you for having me. I'm looking forward to it. And I have not an hour, I have 40 minutes because I have another webinar at 1 o'clock. So thank you so much.
All right, well, we're going to pack it all in then. So let me get started. First thing I want to do, just for those who and just so you know, what we do is people are listening to this live, but then we're going to send a recording out to we have over 23,000 members across the state that we send these recordings to. So for those who may not know you, who aren't in your district or don't follow along, tell us a little bit about yourself, how you got into politics.
Thank you so much. I actually came to this country when I was 8 years old from a beautiful island. I don't know if any of you have ever visited Dominican Republic. In the Caribbean. We share the island with Haiti. And I arrived in New York City, actually, in a community called Washington Heights, which is where most Dominicans literally land. And I arrived with my mom and my sister. My mom was a single mom. And like many immigrants, it's a story of many of us. You know, she did not know the language. My mom didn't even study, I don't think she studied till the 3rd grade elementary school, but she had an amazing, impressive work ethic and instilled that in my sister and I. And she will always say, and I'm gonna say Bobby because you and I know each other well, you know, that when she died, she wasn't gonna leave us anything but an education. And so I decided early on, you know, you have to be careful when you have children, what the words you use, because she used to call me la abogadita, and you can probably relate to this, the little lawyer, because I could never stay quiet, and I always, you know, was helping someone in the community. So I ended up going to college, first in my family to go to college and go to law school. I ended up being a public defender for a little while, and then I worked as a prosecutor with the Department of Justice with Eric Holder. He was my boss in DC. So I always had a just love for service, and I love litigation as well. So that's how I started my career. I never thought I would run for office, Bobby. I never did. I never, it never crossed my mind, except when I decided, my husband and I wanted to stay home with our kids. I started to get involved in the community and getting active and representing the community against certain developments and decisions that were being made by the local council and the university. I ran for the city council, and that's how I got the bug to run for office.
So did you serve in the city council, or?
I did.
You did. For how long?
They're 2-year terms. So I served 1 full year, 2 years, and then I ran again and got reelected. And in the middle of my 2nd term, I don't know if you recall, because I think you served with her, Pauline Menace.
Yes. She and I served on judiciary. Yeah, wonderful woman.
An amazing woman. And she was my neighbor. So, you know, I decided when she retired, and she has served, Bobby, 39 years in the legislature.
Yeah.
So, as you know, you run on a slate, right? The senator and the 3 delegates. And I went to the senator and I said, I'd like to run with you. And they basically said no. And I asked my husband, I said, I said, do you love me? He says, that's a stupid question. I said, well, I need to take some of our money. I'm not asking you for permission, but I'm going to take it because people wouldn't write a check. So I decided to go ahead and rent a space, door knock on 10,000 doors, did 7 mailings, 13,000 phone calls, got a lot of seniors, and I will go to the high school and recruit young people. And we cover all our polls, and there were 9 of us running. I was running against 2 tickets, and I actually won the election, came in second, and I have been there since. This is my 15th year.
Wow.
I have been on the Health and Government Operations Committee all this time. Coming in that manner has allowed me, Bobby, to be free and to really represent my community. I don't have an agenda except the people's agenda. And my community has been amazing, and I'm extremely humble and grateful for their support.
Well, that's great. Let's jump into it since we have some limited time. Tell us a little bit, because obviously the Maryland State Bar Association looks a lot at judiciary or judicial proceedings committee, where there's civil law and civil procedure and so forth. But the Health and Government Operations Committee is an absolutely fascinating committee with subject matter. I know that I've got a whole list of big bills that we're going to hopefully get to in this time period. Just in general, for those who don't know it as well, what is the Health and Government Operations Committee, and kind of what is the subject matter of that committee?
So the subject matter of that committee obviously is health, but it's also government. So we do procurement, right? We do some of the bills that the MSBA is interested in, like the remote authorization bill, right? That came to our committee as well. We do a lot of we regulate all the boards and commissions regarding all the nurses and doctors, right? The health occupation boards. We do a lot of the public health as well. We do insurance as well. A lot of the bills that deal with government and agencies, we actually have jurisdiction over those bills in my committee. So it's an important committee, and one that is very useful and practical.
Can we start with one of the, because I'm interested in this, and because I believe long ago I may actually have sponsored a version of this bill, but I know you've taken this issue and it's not there yet. But you mentioned the remote notarization piece of legislation. That's not into law yet, but where are we with that? If you could tell people what that's about. It seems like an important issue, particularly since everybody's online these days and on Zoom. So where are we in the state, and where do you think that's heading?
So that bill in 2020, Bobby, the governor issued an executive order which enabled notaries to operate remotely due to the number of critically ill individuals in the hospital during COVID that needed notary services during the pandemic. The order was amended to authorize remote notarization for wills and trusts, which we had not done for the duration of the pandemic. The bill would have allowed for will and trust to be permitted to be notarized remotely. There was an amendment to authorize notarization of a tangible record, allowing the remote notarization of documents in ink rather than electronically. There were some clarifying provisions. Unfortunately, the bill came in, it was late at the end of session, as you know, from having been there. And the committee felt that we didn't want to be pressured to pass this bill because it's such an important bill, and that we wanted more time to process and to make sure that we did not have any unintended consequences. So you will probably see the bill again in 2021 and 2022, actually, and I will say that it will probably pass, but it must be heard early in the session, where you can have a full hearing, ask questions, be amended, it goes to subcommittee. Something that we do, Bobby, in our committee that is very different is that the Health and Government Operations Committee works on subcommittees. So every bill that has a hearing then is assigned to a subcommittee where we work it. And what we do that is different, because you have been there, is that we bring everyone during the subcommittee, whether you're for it or against it, and we try to have a good work product, and then vote on it in subcommittee, then make a recommendation for the whole committee. So I think that the bill just needs a little bit of work.
Good. Well, it's an important issue to a lot of attorneys. I remember the issues of making sure that there's safeguards and guardrails on there was complicated. So,
right.
But but we're looking forward to seeing how that moves along, and I'm sure members of MSBA can be helpful on that issue.
Well, I would say, if I will give you some advice for free, introduce it early in the session, very early.
Makes sense.
Because it's going to be assigned to the subcommittee titled Government Operations, which is Sandy Rosenberg's subcommittee. He leads it. So just have to make sure it gets there early, because people are nervous whether or not, people would take advantage of certain, marginalized community, vulnerable community, the elderly. And we just want to make sure that it's done properly. It's not that we're not committed to it.
Makes sense. Well, we're looking forward to seeing it. All right, let's talk about some health issues. You had huge bills this year on health equity and telehealth and health disparities and so forth. I'm going to just open this up to you to talk about what your agenda was this, bill-wise this last session, and tell us about some of these issues about health equities and disparities and so forth, and what we did in this last, or what you did in this last legislative session, and where you think this is heading.
So thank you so much for discussing this. I'm very passionate about this particular issue. I am actually the chair of the Public Health Subcommittee for the House. So what we learned during the last year and a half is that the population that was most impacted was the Black and Brown communities and the seniors, right? So COVID, we have 24 jurisdictions in Maryland, 23 counties, in Baltimore City. We have a little over 6 million people according to the last census. So we discover that the county with the highest number, Bobby, of COVID-19 cases in the entire state of Maryland is gorgeous Prince George's County. So I represent District 21, which is Prince George's and Arundel County, about 127,000 people. So we found out that Prince George's was the one with the highest number of COVID-19 cases. And then when we peeled the onion and kept discovering the impacts, we discovered that the zip code in the entire state of Maryland with the highest number of COVID-19 cases was 20783. Do you know who lives there?
I assume that's your zip code.
Well, not quite, very close.
Or Jim Rosapap.
What? It's the immigrant community.
Right.
It lives there. The Langley Park, Hyattsville area is the 22nd district and a little bit of 21.
Okay.
So we learned that it affected the Black and Brown communities. But why is that? Because of those social determinants of health, right? It is the way they live. I discovered, Bobby, that I was doing food distribution every single day. I didn't miss a day, doing food distribution for the seniors and the most vulnerable communities. And what I discovered is there were people living in an apartment. There were 10 members living in an apartment, where if one was positive, all of them were positive. Right. So it's the way they live in crowded places. It is the environment, the lack of education, lack of transportation, right? All of those social determinants of health, that zip code that determines their health, unfortunately. So we knew that already, but it really highlighted the need for public health funding and the need for us to be creative and think outside the box. So I put in a bill and I started working, and I know you know this because we start early, right? We don't wait till most people put in their bills in January and expect them to pass. It's not going to pass because the committee is not going to do a lot of that work, right? You have to do it. So I respectfully started meeting like for 7 months with whenever I put in a bill, I bring everyone to the table, whether you're for it or against it, because they're going to come out anyway. Might as well, deal with it. So I put in a bill that would require implicit bias training for all healthcare providers in the state of Maryland. So to deal with, the biases. And I brought in all the boards, the insurers, the hospitals, you name it, people that didn't want to be told what to do. We hear that all the time. So I negotiated with them, and by the time I filed the bill in January, the bill was ready to go. Everyone testified in support, thank God. So the bill passed, which is wonderful. And it goes into effect this, actually, it went into effect in October, but the licenses, upon the first renewal of your license starting next spring, people will be required to take this course. And then what I also did in honor of our wonderful senator, your colleague, Shirley Naton-Pulliam, who did a lot of health disparity work, I actually put in the Shirley Naton-Pulliam, Health Equity Act, which actually brings all the members, all 26 cabinet, members of government, all those departments. It requires them to develop a health equity framework for all the policies of their departments, to meet 4 times a year, to work with Chris, who's our, designated IT for the state of Maryland, and to look at the data, right? Because the data should be what drives the policy, right? I always say, Bobby, that the policy, the money should follow the policy, not the policy should follow the money. There is a difference. Right. And it basically will require them to do this equity framework for every single department, and to talk about, the marginalized community, but not just about health, also about food insecurity, the environment, because all those factors affect our health. It is a permanent commission in government, in state government, so I'm very proud of that. Because if we really want to make a difference and reduce those health disparities, we have to talk about the big elephant in the room. And it's a tough discussion to have, but it's important. And what the bill did, which I'm sure you read about it, is that it declared racism as a public health crisis in the state of Maryland. So, when I put in the bill, that the Shirley Naton-Pulliam bill declaring racism as a public health crisis, the Republican senators in the Senate stripped that from the bill. And then the House put it back in, and actually the governor allowed it to go into law without his signature. So I thought that was important.
Have they started, has that group started meeting yet, or is there any indication it's kind of the focus that they're gonna, are there specific focuses like education or, development or Section 8 housing or whatever it is that they're gonna be focusing on in order to, come to some solutions on this? Yes,
so they met, they had their first meeting on October 18th.
Okay.
And I met with the secretary prior to that meeting. He's I have to say, he's very committed to it. And they all met, and they have an agenda. They're creating advisory committees, and they are looking for people from the community to apply for these advisory committees. Which one will deal with the policy, the other one deals with the data. So if anyone has an interest in health disparities in health, and guiding our policies in our state, this is a great opportunity for your members, because we need lawyers, right, to be involved. So your membership can make a difference by volunteering for these commissions, and having a real impact by being at the table and driving the policy as well. So that commission has met, which is wonderful. Another bill that I put in this session that I actually led with Senator Griffith, which she's an amazing partner, Melanie Griffith, the President Pro Tem, is a bill that expanded the use of telehealth, right? There was an emergency, the governor passed an order allowing it, but we wanted to leave it permanently because we learned about the benefits of it. And what it does that's really good is that it requires reimbursement for audio only, audio as well, right? Not just, the video, but also audio, a telephone call, which is important because not everyone has access to the internet, as we know, especially in the rural areas.
Right.
It's very unstable. So our focus was on health disparities, on access to health as well, which is so important. That I put in a bill that actually required actually the Maryland Health Benefit Exchange to put in a request for a 1332 waiver through the federal government for us to do something innovative, which was to create a reinsurance program to help people pay for their premiums, to reduce those premiums And I assess a small fee on the carriers, and we have received, Bobby, $1.2 billion in
Wow.
pass-through funding for this program. And for the last 3 years, we have been able to reduce the number of uninsured, and we have been able to reduce the premiums for people that are in the individual insurance market. So I'm very biased, but we're doing great things in our
It sounds like you're doing and like I said at the beginning of this Zoom, like there's a reason we were excited to have you on here. I mean, these are big ticket issues, and it's fascinating. It is interesting, although I don't want to get into it right now, but coming from the legal background and being a public defender and working in the Department of Justice, and now you've become the legislature's expert on public health issues. It's interesting how you've moved from one kind of focus to another. But I do want to continue listening. I mean, these are big issues, and I love the idea of, and we certainly should reach out to folks in the public health area, people that do public health law, and see if they'd be interested in participating on some of these commissions. In terms of, there was another bill, which I know didn't, and I remember this one, and my delegate had it before he left, Delegate Morheim. I am interested in it. I was always interested in the debate on this. It never really got anywhere in the Senate, and I know it hasn't gotten into law yet, although there was an article just today online that I got randomly before you and I got on. And this has to do with the idea of substance abuse and the use of sites. I don't remember the exact wording of what these sites would be called, but I know in places like Canada, they've used them and with some success in trying to get people to stop overdosing, which has become a huge epidemic in our state and across the country. Can you talk about that issue? I guess it's substance use sites or safe use injection sites or what have you. I can't remember the name of it.
Overdose prevention sites.
There you go.
So look, overdose prevention sites are a proven solution to the opioid overdose crisis. And data shows that the overdose fatality dropped 35% in the area around a single overdose prevention sites within 1 year of opening. So it works. There are over 200 of them all over the world, a lot of them in Canada and Europe, and they work. So the way it will work is that basically we put in this bill, and the bill was introduced for the last, Delegate Morheim, Dr. Morheim, that was his baby. Right. So at least he introduced it at least 4 times or so. And then Senator Hedelman and I have been introducing it, I think, for the last 3 years. So the bill would authorize safe injection sites where people could use opioids near trained staffers. So we will have doctors and nurses who can respond immediately if there's an overdose. There has never been, Bobby, a documented fatal overdose in a supervised consumption program. And evidence from cities with current safe, site consumption shows reduction in the area. So the idea is to have a safe place for people to come. We do not provide the drugs. They bring the drugs to be able to provide them, with clean, all the stuff they need that is clean and sanitized. And if there's an issue, for them to have a doctor, a nurse on the premise. And if they wanted to seek counseling, we will also be able to provide that as well. The bill as introduced basically was going to be a pilot, and it was only going to have 6 locations. It will be up to the locations, to apply for it. We're not going to force this on any jurisdiction. But the fact is that our numbers are horrible. Every year we lose more than 2,000 people to the opioid crisis. And most people, Bobby, they die alone in a dark alley, in a bathroom. Wouldn't you, if this was your loved one, wouldn't you want your loved one, if they're going to use, to be able to do so in a safe manner? And this is what this bill would do. It works everywhere else. We need to think outside the box and be creative. And this is simply the right thing to do because our numbers are devastating.
It is it never came to JPR. It always went to finance in the Senate. So I never get to hear the hearing, although Delegate Moorheim was always in my ear about it. And it does sound like the numbers are overwhelming. It's a hard bill from it's easy to kind of demonize a bill like that, but I'm glad that you've taken it on, because it is definitely an interesting, from the standpoint of the opioid epidemic. I mean, it's only gotten worse during COVID. So it'll be interesting to see how this comes along.
Well, what happened was that, no offense to anyone, because this is not partisan, but the Republicans did a mailing in the districts of people that co-sponsored the bill. And the mailing it was a postcard with an ice cream truck and the drugs. So, which is, very, very misleading, because we do not provide the drugs. And in most instances where these safe consumption places, overdose prevention sites are located, we work, with the police. They know not to arrest anyone, right? There's a good working relationship, but there's a lot of misinformation. So we have taken the last year to really educate people on what the bill would do and on the need for it, because even with COVID this past year and a half, Bobby, the numbers have gone up. And what it's now doing is that there are a lot of pregnant women giving birth to children that are addicted to drugs. And we're seeing those numbers going up. I think, it's important. During the crack pandemic, what we did was we arrested our way through it, right? And because and I hate to say this, it affected a lot of us, people of color. Now we're trying to find a solution, right, to this problem. And it is a good way to deal with it, because drug addiction is an illness. It is an illness, and it should be treated as such, and not, penalize people and warehouse them where they're going to come back and have the same problem, right? You want to give people the tools to be able to function and to be able to be active and involved in the community. And I think that this is a good, creative way to do it. And I think it passes.
Definitely a big issue to watch, and we will certainly be monitoring it. It's a controversial issue for the reasons you stated. It's easy to kind of the education on this is critically important. Anyway, we've gotten through a bunch already. So many more to do, so I'm going to try to rush through some of these before I have to let you go. You talked a little bit in the last year when I was there. One of the issues along the same lines was the use of medical cannabis to as a not a solution, but as something related to substance use, to opioid use disorder. And there was some thought about the use of cannabis through the medical program to assist there as well. I'm not going to ask you about that. We have decriminalization and medical cannabis, and all of a sudden in the news we have this big focus on recreational legalization of cannabis. And so I know you're on the work group, and obviously there's a public health aspect to this as well. So again, open-ended question: where are we with this at this point, and where do you think this is heading?
So thank you for the question, Bobby. The speaker, our wonderful speaker, who I'm very proud to serve with her, Speaker Adrian Jones, has created a marijuana legalization work group. And we started meeting. We actually had our meeting on October 13th, our last meeting, and we're meeting again next month. And, during the work group, we compare the different states that have already legalized cannabis in Maryland. We talked about the pros and cons of legalization. We're looking at potential policy and legislation, perhaps a referendum to allow people to choose, right, to tell us what they want to do. We're listening now very actively to multiple experts' viewpoints on the data, the public health, what is the impact on children, on pregnant mothers, right, addiction as well, because we have to discuss those including the potential risk and benefits. We talked about the last meeting. I was actually in charge of that meeting, of getting the speakers for it, because I am in charge of the public health committee for that work group. We talked about the adult versus the child adolescent usage as well. And we are basically, Bobby, doing our homework. We're going to look at different states. We're going to see what is the best policy out there. What is the public health impact? And hopefully have a good discussion and recommendations for the 2021 session.
So I will not pin you down, and you don't have to answer this, but where do you think we're going to be at the end of the 2021 session? If you want to punt that one, I certainly understand.
I think that, there's going to be probably, a referendum. Not that I'm saying, and this is just me guessing. Not sure about a bill, but certainly, a referendum.
Okay. All right. Well, again, big ticket issue that we'll be monitoring. I know there's a big public health aspect of this, so I know you'll be front and center on the issue. I did want to ask you about the Government Office of Immigrant Affairs. I didn't want to leave without that. That's a big issue that you tackled, and something, to something large in state government. Can you talk about that, and what was the rationale for it?
So I put in, that was House Bill 15 that creates the first Government Office of Immigrant Affairs. The rationale was that during this last year and a half, I actually have been doing a lot of work in the immigrant community. I represent everyone and with the same passion, but my first language is Spanish. And as a Black Latina, I have kept involved with the community. I have a radio show every Monday morning in Spanish where I try to inform the community on the different laws and help them to integrate into the community. So I saw that there wasn't, Bobby, an office that could give help to this community. We didn't even have a list of programs and that are available and resources. So I ended up spending weeks putting together what I call a brown paper on all these different programs, whether it was the food pantries and different government offices. And I worked on it with two other women, and we got it done. And you can find it at the office. I spoke to the Attorney General, Brian Frush, and he actually asked me to give it to him, and he put it on his website, because we did not have a centralized office and message. So this office will be established in the governor's office of, would establish a governor's office of immigrant affairs, and it will create a network of neighborhood-based centers that will provide immigrant services, assist the immigrant community in finding work. It will centralize, a statewide effort for the community. It requires the office to have a 1-800 number as well for the community. It requires the office to have staff and to coordinate policies and resources targeted to the immigrant community. It will create and require casework as well. So it's a way to help the new immigrant, the new Americans, to find everything in one place so that they can adjust to this society, to their communities, and to be impactful and to make life easier. And I think it should be a priority, and priorities must be funded. So that is the reason why I, created and put in House Bill 15. And the governor,
this legislation passed?
It passed, and the governor allowed it to go into law actually without his signature. So I understand that he has appointed an executive director, which I actually, I have a meeting scheduled with her this week. I also met with a person you know very well, Secretary David Brinkley, to make sure that it's funded, because I want it to be funded. Otherwise, it's not going to work.
Great. Huge, big issue. I mean, we've been 40 minutes and we could go on and on. I want to be very mindful of your time, which I know we kind of have a hard stop. So you just tell me when I've got about a 1-minute warning. But
You have a 1-minute warning.
okay, well, there we go. Well, so much more to talk about. Let me just ask you in 30 seconds, because obviously this is going to be not only a political issue, but probably a legal issue as well that may quickly make its way up to our Court of Appeals. Redistricting in 30 seconds. What are your thoughts on it, and how crazy is this going to be in Maryland politics this year?
Well, we're having a special session on the week of December 6th, I believe. And we are going to be drawing the maps for the congressional maps, because we have to do that this year. Now that we have the census number, we're a little delayed because it took a while to get those numbers. And then we're doing legislative redistricting during the regular session in 2022. So as you know, it's because you have lived through it, is going to be a tough process. But I'm looking forward to the work. I'm looking forward to looking, at the data that is presenting, looking at the growth in different districts, and making adjustments of those lines.
Got it. It's a complicated issue. I won't ask about timing because it is fascinating, because with a truncated schedule, when I went through it, primaries were in September, not in June. So
June 28th.
Right. So this is going to be a very truncated schedule. All right. I know you have a hard stop here. Let me just say to you, first of all, thank you for joining our membership today, Maryland State Bar Association. It's a pleasure to listen to you talk about all of these really important issues in the Health and Government Operations Committee and elsewhere. I know your time is limited, so I just want to thank you on behalf of the bar for joining us today, and we look forward to everything that's coming this legislative session.
Well, I want to thank you, Bobby, for being an amazing moderator and for taking, the time to have a real nice conversation with me about my passion and the work we're doing in the legislature. And I want to tell your membership that there is room for you. On a personal level, you have representatives. You have a senator and delegates. So, write to them, look at what they're doing, tell them your opinion on certain bills, because it matters. On a professional level, your voice as the Maryland State Bar Association is important. When I see a letter, and Bobby can tell you that we look for these letters of people we respect and their positions on certain legislation, it matters, because I am in the profession, and I respect the work you do, and I want to hear from you. So please stay involved. And finally, please volunteer for these boards and commissions, because our profession, legal profession, needs to have a voice and be at the table. So I thank you for the work you do. I am honored to be with you today, and I hope you have a blessed day. Thanks for everything you do.
Thank you so much. And again, thank you all for joining us on Coffee and Conversation with Star of the Maryland House of Delegates, Delegate Joseline Peña-Melnyk, and we thank you for your time today.
Thank you. Take care. Bye-bye.
Bye-bye.
Bye-bye.